My name is Satish Ganesan. I'm a consultant in trauma orthopedics and spinal surgery. My area of expertise is spinal surgery, and I predominantly deal with lower back conditions and common cervical conditions. I also provide support to the trauma services within the NHS at the Conquest Hospital. I completed my training in 1999, qualified from an esteemed institution in India. I subsequently moved to the United Kingdom, doing much of my higher specialty training in Dorset. This culminated in my fellowship in Southampton, with me taking a consultant post at East Sussex in 2015. I am a member of the British Orthopaedic Association and the Association of Spinal Surgeons in the UK. Through my medical training, I was always fascinated by trauma and orthopedics. I enjoyed the trauma aspect initially, dealing with acute medical situations and helping people in need. I subsequently specialized in general orthopedics before going into spinal surgery. The spinal surgery is a fascinating area where presentations can be quite complex and challenging, and it is indeed a pleasure to see and help out these patients in pain, coming to a diagnosis and offering them various choices, which may include non-operative therapy, targeted injections, and sometimes complex surgery where needed. In the current medical scenario, it is not uncommon for patients to have waited very long periods, suffering in pain, before they have access to specialist medical opinion. It is understandable that there is a lot of anxiety when one comes to see me. I provide each patient sufficient time and space to express their concerns, detailing the suffering they have. We move on to having examination with regards to the condition before discussing various results of investigations. I often find, once patients understand the nature of the condition, seeing the pictures of their scans amongst various other investigations done, they develop a good insight into their condition, which helps them not only understand the condition better, but also manage it. I find this helps the patient's journey, and where further tests, treatment modalities, be it injections or complex spinal surgery, is required, we often provide all information, including information booklets, which patients are allowed to take home, reflect upon before making an informed choice as to how they may wish to proceed on with their management. Patients who require complex surgery often are brought back to formal consent clinics once they've reflected the information before they clarify any questions they have, and this gives them an opportunity to clarify all their doubts before coming in to have their surgery, which allows them to have a greater and positive experience at the time of surgery. I have indeed been fortunate to work at the Benenden Hospital. I started work here about 3 to 4 months ago, and it's been a pleasurable experience. I find there's great infrastructure and wonderful staff members to support me through my work. Benenden itself, as you're aware, offers affordable insurance policies which can be accessed by a vast majority of the population, and with the infrastructure services available here, I suspect most patients have a very positive experience.